and thank you for joining us today. I'm Dr. Bruce Vanderhoff, Director of the Ohio Department of Health. We have a lot of important updates to share today, and I want to start by talking about the national monkeypox outbreak and Ohio's vigorous response. Also, with the start of the new school year, I'll provide an update on where we stand with COVID-19 and discuss the importance of childhood immunizations. We're privileged to have two expert guests joining us today who will help us dive deeper into these issues. Dr. Joseph Castaldo, Medical Director of Infectious Diseases with Ohio Health, and Dr. Michael Forbes, Chief Academic Officer with Akron Children's Hospital. First, I'd like to share the latest information about monkeypox cases in Ohio, as well as general trends across the country. As of Wednesday, the Centers for Disease Control and Prevention had reported 10,392 cases nationally, with the highest spread in New York, California, Florida, Texas, and Georgia. All of those states have at least 700 cases. The Ohio Department of Health reported the state's first case of monkeypox on June 13th, and our case count remained very low in July. As of Wednesday, we have reported 75 cases to the CDC. Most of Ohio's cases are in our large metro areas, with only a few cases reported in other jurisdictions. It's important to emphasize that monkeypox is not spread like COVID-19 spreads. Unlike COVID-19, it doesn't spread as easily between people. Monkeypox is spreading mostly through close, intimate contact with someone who has monkeypox, most often through direct contact with the infectious rash, sores, scabs, or body fluids from a person with monkeypox, or from respiratory secretions during prolonged face-to-face contact. While according to the CDC, 99% of nationwide cases are among men, and 94% are men who have reported having sexual or intimate close contact with men, it's important to recognize that anyone can be infected with monkeypox if they have close contact with someone who has monkeypox. Fortunately, most people who get monkeypox get better without the need for medication. Thus far, according to the CDC, about 8% of people who have contracted monkeypox in the United States have been hospitalized, and thankfully, there have been no deaths. Thus, while the risk of contracting monkeypox for most Ohioans remains low, it's important for us to continue to do all we can to mitigate the spread of this virus and to reduce the burden of illness. Now, from the beginning, ODH has actively worked with our local health department partners and healthcare providers to provide monkeypox testing, case investigation, contact tracing, as well as prevention and treatment options. And we will continue to actively support our local partners who are best positioned to provide trusted, accessible outreach in their communities and to serve Ohioans where they live and work. Mitigating any outbreak begins, of course, with prevention. And with this in mind, we've been working with local health departments, healthcare providers, and associations that can help us reach higher risk populations to share important information about prevention. We've also sent health alerts to health providers through their state associations and licensing boards, covering clinical recognition of monkeypox, specimen collection, how to ship specimens for testing, then to either the ODH public health lab or other participating laboratories. The Ohio Department of Health considers it very important to keep the public informed about this outbreak. We've had a page on our website that contains information on the disease, and we're preparing a dashboard with data that should be ready very soon. A significant challenge thus far in mitigating this outbreak has been a national and international shortage of the Jynneos vaccine. the supply of Jynneos is limited worldwide and is being allocated by federal authorities to jurisdictions in the United States based on each state's burden of illness. While this has certainly been a source of anxiety and frustration for many across the country, it's a direct reflection of the extremely limited global supply. Now, because Ohio has had comparatively fewer cases than other states, our allocations have likewise been less than some harder hit states. But rest assured that Ohio continues to actively advocate for more vaccines. And as more vaccine has become available, has promptly placed orders for the maximum allocated doses. Until this week, the state had been sent 4,253 doses. Now, this is a 2-dose vaccine, so that was enough to vaccinate a little more than 2,000 people. This is simply not enough supply to vaccinate all at-risk Ohioans. Therefore, our strategy in the face of these national limitations has been to get available supply out as quickly as possible to Ohio communities with the highest case counts and the highest risk for spread. This currently includes Cleveland, Columbus, and Cincinnati. Now, more vaccines have been allocated recently, and this week we received another shipment of 5,440 doses. We anticipate that additional allocations will be available to us over the coming weeks for a total eventually of 13,560 doses. Also, of course, within the past 24 to 48 hours, the FDA issued emergency use authorization for Jynneos to be administered intradermally, which requires 1/5 the dosage volume of the prior subcutaneous injection, which in turn should further enhance our ability to provide vaccination to more people. This epidermal administration is known as an alternative dosage regimen. The Ohio Department of Health is supporting local health jurisdictions' efforts to use the alternative dosage regimen to ensure that this vaccine is more widely available to those who are considered to be high risk. We are working with our local partners to allow for vaccine to be made available in all jurisdictions based on the number of cases, their population, and those who are considered high risk. Now, I'd like to turn now to our first guest to talk a little bit more about monkeypox, including its risk, its spread, its prevention, and its treatment. And for that, I'm joined by Dr. Joe Gastaldo, Medical Director of Infectious Diseases at Ohio Health. Dr. Gastaldo, can you tell us how you feel people should be thinking about monkeypox? We've said it spreads through very close contact, so perhaps you can help us understand the types of activities that create risk and the types of activity that really do not create risk. What can people do to feel safe, and what activities should they have their guard up about?
Thank you for that question, Dr. Vanderhoff. From a public perspective, with us still having up nationally 500 deaths a day, the virus that's still most concerning for the general public is the virus that causes COVID-19. Monkeypox is here, but it is nowhere near as easily transmitted as monkeypox virus. For someone to get infection with a monkeypox virus, it really requires close, intimate contact with somebody. Somebody has to have skin lesions that touch somebody else with prolonged exposure. In addition, it can be spread through respiratory droplets, and I think that really causes a little bit of anxiety with COVID-19. But when we say respiratory droplets, it's a prolonged exposure to somebody who has monkeypox and their respiratory viruses. So we really want to recognize that the biggest risk for monkeypox virus infection are those individuals in the community of men who have sex with men, whether it be gay men or bisexual men. We want to respectfully engage that community to really give them the information they need to best protect themselves.
Dr. Gastaldo, as the Department of Health continues to work to distribute vaccine rapidly out into the state, we understand the desire for people who may believe themselves to be at higher risk to get vaccinated. But even if one does get vaccinated, can you tell us about what precautions those who are vaccinated still need to take, and when they can expect the vaccine to be ready to offer them maximum protection?
Dr. Vanderhoff, as you know, with any vaccine, no vaccine is 100%. And I think it's important for people in the community to realize that if you get the vaccine, it's not a monkeypox free pass, meaning that you still have to wait to be fully vaccinated, and that is 2 weeks after the second dose to have the maximal protection from monkeypox. Now, we don't know with certainty if the vaccine is going to prevent people from getting monkeypox. It may be that after somebody's fully vaccinated, they could still get monkeypox, but their case would be milder. So again, we want people to understand this. It's not a free pass if you get the vaccine, whether it be 1 dose or 2 doses.
Dr. Castaldo, I mentioned the alternative epidermal dosing regimen for Jynneos that the FDA just authorized and that the CDC has endorsed. Can you tell us anything more about that epidermal administration?
Yeah, having the intradermal administration is really going to increase our supply of the vaccine to really give to at-risk communities. So when you look at how vaccines perform, we really want to get a good immune response. And there was a study done showing that the immune response, specifically the antibody levels, when you give it underneath the skin as an intradermal injection compared to giving it subcutaneously, is measurably the same. So that is good. And that is really going to allow us to have more vaccines. As you stated earlier on, Dr. Vanderhoff, I could tell you within the community of men who have sex with men, the demand for the vaccine far outweighs the supply at this time.
What about the treatments for monkeypox? We do have some treatments that are available. Can you tell us about the indications for those treatments, and what are some of the concerns that may go with those treatments?
Yeah, Dr. Vanderhoff, that's a great question. I think it's important for people to understand that most people who do get monkeypox will not need any type of treatment. It's basically supportive care. But we have to be cognizant, and when we say supportive care, some people who have monkeypox can have uncontrolled pain, uncontrolled itching, and those people really have to be cautious with isolating themselves and not allowing monkeypox to spread to other people in their circle. There is a medication available for people who have severe infection with monkeypox, or for those individuals with medical conditions that puts them at risk for higher severe disease. And those conditions are really a pregnancy, a woman who is breastfeeding, somebody who is immunocompromised, somebody who has advanced HIV infection, or somebody who really has a severe outbreak. The medication goes by the trade name of TPOXX. This medication is available through the CDC and the Ohio Department of Health.
Thank you. And finally, while of course, the CDC and the Ohio Department of Health recognize how important it is for people to get good information about monkeypox, and we've made resources available online, sometimes people have very specific questions that relate to their own individual care. What would your advice be for them in terms of some of the other resources they might turn to for guidance regarding their specific questions?
Yeah, I can tell you here at Ohio Health, we've really been on point providing a lot of education to providers in the ambulatory space. So I think that's generally the case with most healthcare systems. People can reliably return to their healthcare provider, whether it be a physician, a pharmacist, or a nurse practitioner. In addition, in Ohio, we have local health departments who are really on point, understanding the appropriate advice to give to people. And we have to be cognizant that there are people who do not have primary care physicians or providers to turn to. And I think that's really the niche for the local health department, to really provide information for people on how to get tested and other questions related to monkeypox.
Terrific. Thank you so much, Dr. Castaldo. Well, the fact that COVID-19 is not the first topic of our press conference today is in and of itself an encouraging indication of how far we've come in dealing with this illness. While we certainly know that SARS-CoV-2, the virus that causes COVID-19, hasn't gone away, it appears that the modest surge in cases recently caused by the Omicron subvariants BA4 and BA5 may have hit its peak or at least leveled off. These variants are highly contagious, and many people who were fully vaccinated contracted the virus, but with mild to moderate illness. But as we have said all along, our vaccines have continued to hold up very well in providing what they were designed to provide, and that's to prevent serious illness and deaths following infection, not to prevent a cold or a moderate upper respiratory infection. With this type of illness, infections are going to occur. But if you're vaccinated and have a good immune system, your symptoms should be more limited, and you should be less likely to end up needing oxygen or ventilatory support in the hospital. And that's exactly what we continue to see. While cases rose this summer, the number of those requiring oxygen or going into the intensive care units stayed very low. Of course, this only serves to emphasize the importance of completing your vaccine series, which for most people means the 2-shot primary series of the mRNA vaccines made by Moderna or Pfizer, and then a follow-up 3rd shot. In Ohio, 68% of adults have now had 2 doses. And while that's a very encouraging milestone, it still leaves 2.6 million adults who've had 2 shots, but haven't rounded off their primary series with that 3rd shot, which has proved to provide an impressive level of durable immunity against severe disease. Of course, as we head into the fall, we're keeping an eye on the development of a new variant-based booster, which may be ready as soon as September. And we'll share more information on that as we receive it. Waiting for that new booster may not, however, be the best way to protect yourself now. If you're older, unvaccinated, or not up to date on vaccinations, you're at continued risk for more serious illness. I encourage anyone who's not up to date with their vaccination, including those currently eligible for a 1st or 2nd booster, to seize this opportunity to prepare for the fall. Well, it's that time of year again, back to school. And as we think about the new school year, it's a very good time to consider our children's vaccinations and the impact they have on preventing illnesses. Just for a moment, let's set aside COVID vaccine talk and discuss the fact that too many of our children continue to suffer from some of the more traditional vaccine-preventable childhood illnesses. And these include pertussis, which is also known as whooping cough, varicella, which is known as chickenpox, and pneumococcal diseases. Sadly, each year in Ohio, more than 1,000 children come down with diseases that would have been preventable if parents had kept up with their children's recommended vaccine schedule. And recently, there have been several scary examples of what can happen if we don't remain vigilant about keeping vaccinations up to date. Earlier this year, the Ohio Department of Health announced that a case of measles had been confirmed in a child. Fortunately, the case did not lead to a wider outbreak, such as our state experienced in 2014, when 382 cases were confirmed. Measles can be a nasty illness, particularly for young children. A rash, high fever, and cough can lead to serious complications, including pneumonia and even death. Also this year, a case of polio was reported in New York in an unvaccinated adult. And the New York State Health Commissioner has reminded everyone that based on earlier polio outbreaks, for every 1 case of paralytic polio that's observed, there may be hundreds of other people who are actually infected. Now, most of us are not old enough to remember a time when polio was a widely feared illness, routinely paralyzing or permanently debilitating thousands of Americans. A vaccine developed in the 1950s led to the virtual eradication of polio in the United States, but cases still pop up across the globe. And now, ominously, the polio virus has been detected in several wastewater systems in New York, signaling that there may be community transmission happening. So It's certainly no stretch to say that these are the types of diseases that could increase among us if we don't stay vigilant about vaccinations. In Ohio, the percentage of children entering kindergarten who've had all of the required school immunizations appears to have fallen in each of the past two school years, 2021 through 2020 through 21 and 2021 through 22, although admittedly the 2021 through 22 data has not yet been finalized. Some of this is almost certainly due to the impact of COVID-19. Many people nationally missed routine well visits during the early days of the pandemic, and many schools were conducting remote learning, perhaps lessening the opportunity as well as the sense of urgency for parents to get their kids vaccinated. But we need to always bear in mind that today we are very much residents of a global community. And there are serious diseases that have not been wiped out or reduced to the degree they have in the United States that remain in global communities. As a result, our vaccinated children are safer, but our unvaccinated children remain quite vulnerable. The good news is we have the tools to protect them. So let's use them. Let's get our kids' vaccinations up to date as they head back to school. And now joining us to discuss children and vaccinations is Dr. Michael Forbes, Chief Academic Officer from Akron Children's Hospital. Dr. Forbes, we've shared why we think keeping up to date with vaccines is important as our kids return to school. As a pediatrician, what's your usual advice to parents about childhood vaccines and why you continue to advocate for them?
Sure. Thank you for the question and the preamble, frankly, that really reminds us how effective vaccines have been for so long, and we'd like to keep it that way. The message to families that we really try to communicate is we try to prevent what's preventable. That's what we do when it comes to helmets, seatbelts. Bad things can happen and do happen. But as parents, we have a duty to protect our children. And so having an effective, safe vaccine that prevents these common illnesses, I think, is really important as a part of that regimen of getting ready to go back to school and interact with other children who, frankly, may or may not be adequately vaccinated.
Thank you. You know, when it comes to the COVID-19 vaccine, we know that comparatively, children really do seem less likely to get severely ill, but we also know that some children do, in fact, develop serious complications, and sadly, several have died in Ohio. What advice do you give parents around the COVID-19 vaccine as they're preparing to send their kids back to school or maybe back to daycare?
Yeah, great question. You know, I think that as we go back to school, the message culturally has been that COVID-19 is extremely mild in children, and there is data to suggest that they can certainly not have as severe disease. They certainly can carry the infection and transmit the infection. But I think it gets back to what we've learned. So we're 2.5 years into the pandemic. Some people say post-pandemic, it's pandemic recovery, I guess. And we've learned a lot. I think what the science has taught us is that while it is milder disease, it absolutely happens. The vaccine, in addition to natural immunity, actually confers very powerful immunity. And you mentioned earlier, the goal now is durable immunity that prevents severe disease. That's the goal now. And so we know how to do that. Natural immunity works well. Vaccine immunity really enhances that. And so even if you've had COVID disease, we recommend you get vaccinated because the combination really provides that durable immunity against severe disease. And so we know that it works against severe disease. It reduces hospitalizations, it reduces deaths. We also know that after your COVID disease is over, even if you've had mild disease, you can still have disabling illness. And so we know that the vaccine also reduces your likelihood of disability as well from multi-system inflammatory syndrome in children, long COVID or post-COVID syndrome. And so natural immunity, again, is terrific. It works. But we have the advantage now during pandemic recovery to have a safe, effective vaccine that prepares kids for whatever's coming their way.
Thank you. Well, as I'm sure you know, the Department of Health is very concerned about helping to reduce barriers to
Yes.
care in all of our communities. We're proud of some recent grants, of nearly $7 million to 26 organizations in Ohio's health improvement zones. And that's money that will be used on projects that increase access to some vital resources. How important a role can childhood vaccination, or in a broader sense, investing in children's health, play in improving long-term healthcare outcomes in some of our communities that are most at risk?
Sure. I love that question. That's a terrific question. Investing in child health is investing in the future of your community. It's really important to make sure that our resource allocation focuses on prevention. Many of the conditions we're dealing with today in adult healthcare began in childhood. And due to whatever reason, a series of reasons, were allowed to continue into adulthood. And so we have an opportunity today to make an impact on the future of the health of the state of Ohio by really focusing our investment in pediatric research and pediatric preventative measures. It's critical. We can continue in our current state, but I think we have an opportunity in this moment to really enhance the investment in pediatric healthcare, pediatric research, to make sure that the next generation of adults are healthier even than this generation of adults. And that's how we're going to do that.
Thank you so much, Dr. Forbes. Well, as I conclude, I want to briefly discuss the latest COVID-19 guidance for quarantine and isolation. As the disease continues to evolve, our population is much better able to cope with COVID-19 than when the virus first appeared on the scene. We now have much stronger immune resistance, stemming, as we've just discussed, from a combination of vaccines and prior illness. We have access to vaccinations and boosters for nearly every age group. And we have widespread access to treatments proven to reduce the risk of serious illness and hospitalization for some of our most vulnerable. As a result, our guidance regarding how best to keep our students safe and healthy as they return to school continues to evolve, as does guidance coming from the CDC. Our guidance for this school year will focus on the recommendation that students stay home from school for 5 days when they're ill and test positive for COVID-19. We are no longer recommending our mask to stay, test to play guidance. Rather, we're offering advice very much like that we likely heard from our parents and teachers. If you're feeling ill, stay home and away from others. Now, reports indicate that the CDC will likely be updating its guidance very soon, perhaps even today, including changes to quarantine and social distancing. And we'll share that information as soon as it becomes available. Having access to a rapid antigen test at home remains an important consideration because it can help parents determine whether their child is merely under the weather or has COVID. When in doubt, it's safer not to send your child to school if they feel sick. Now, we have to remember that localized outbreaks do, as we saw over the course of the past few years, occur. And your local health department, working with your school district, should be your trusted guide for when additional precautions might be needed based on conditions of spread in your community. As we look forward to this school year, I am looking forward to a very productive, safe, and healthy return to the school year. Thank you. And Ken, I think we can now take media questions.
Okay, thank you, Dr. Vanderhoff. Our first question today is from Danae King with the Columbus Dispatch.
Thanks, Ken, and thank you all for doing this. I'm working on a story right now about monkeypox, and so I had some questions on that. I think you addressed this a little bit, but I was hoping to hear just a little bit about what you all would say to people within the LGBTQ community who are, at higher risk for this. Some of them have expressed to me that because of the way this has been rolled out and maybe because of the lack of vaccines, they feel that public health officials aren't caring as much about their community. They can't get information or access to vaccines, and they just kind of seem to feel like people aren't understanding what they're going through. And some even compared it to the stigmatizing of care during AIDS in the 1980s. I'm just curious if you guys could, respond to that. And what do you want people who are most likely to be impacted right now to know?
Well, let me start, and then I can turn, especially to my colleague, Dr. Castaldo, given his expertise in infectious diseases. Let me begin by saying I understand how people might have some of those fears. I experienced the early years of the AIDS epidemic as a medical student and young physician, and I saw firsthand how stigmatization can adversely impact a public health response to an emerging infectious disease. It really reinforced for me that with any emerging infectious disease, whether it's monkeypox or any other, what impacts some of us really impacts all of us. And that our best opportunity for collective success is a robust response from the beginning. Now, the limited international and national availability of the Jynneos vaccine is indeed extremely disappointing and frustrating. Believe me, I share that sentiment. But make no mistake, the Ohio Department of Health has been and will continue to push for vaccines for Ohio and to work with our local partners to get those vaccines out and into arms. But let's also remember that the vaccines, as Dr. Castaldo shared with us just a short time ago, are not a cure-all. Everyone needs to be mindful of high-risk situations and avoid those when possible, especially in the face of this current threat. Dr. Castaldo, would you have anything you might want to add?
Yeah, thank you, Dr. Vanderhoff. And I do appreciate this question because obviously we don't want to induce fear, homophobia, transphobia, or stigmatize anybody's sexual preferences. So I really much do appreciate that question. I will say this, this is monkeypox. What we are dealing with now is almost like COVID in a way, because we are doing something and dealing with something that we have not had to deal with in a short period of time. When monkeypox first came on the scene nationally and in Ohio, we had limitations in testing. That has improved. We are getting the message out there to providers. We have improved the testing capacity. Getting tested is much easier. I was talking to an infectious disease colleague of mine saying, oh my gosh, I've never seen monkeypox before, but it's something that nobody has seen here outside of our small little outbreak in 2003. So it is a new situation that we are all in together, but I do feel confident that things will get better in that regard. I'm very encouraged by the new FDA authorization of allowing us to give the Jynneos vaccine intradermally. That will increase the vaccine amount by a factor of 5. We need to make sure that the vaccines are targeted most to those at risk, and we really have to focus on equity for those vaccines and making those vaccines available to those most likely to encounter monkeypox. And right now, that is in the community of men who have sex with men. Outside of that community, with the exception of household transmission, we are not seeing monkeypox being transmitted in grocery stores or by shopping or things like that. You really have to have close, intimate contact with individuals in that community.
Thank you so much.
Okay, our next question is from Dan DeRoos with WOIO.
Good afternoon, Dr. Vanderhoff. Thanks for the time again. This sort of piggybacks on that. It was very easy when we first got the COVID vaccine in limited supply. It's very easy for the state to say, our elderly population is the most at risk, put them in the front of the line. Here's the age breakdown. And we saw that very, very clearly. That doesn't seem to be happening here. And is it because there is this fear of alienating men who have sex with men? But isn't that also being counterproductive? If the message isn't getting out to our gay transsexual population, aren't we harming the message by not getting it out? We keep hearing you say, the population who's most at risk, the people who it seems to stop right there. Doesn't the message need to be sent more clear? Here is exactly who's at risk. Here who should be put at the front of the line, the exact same way we did with the COVID vaccine.
Yeah, so a couple of questions there, Dan, that I think I can address. First, in terms of how we're describing those who are being impacted by the disease. I think that we have been pretty clear. Both Dr. Castaldo and I now have both repeatedly indicated that the transmission is primarily happening at this time within the population of men who have sex with men. But we've also emphasized the reality that any human being can acquire this virus, that everyone has to be mindful of the kinds of interactions and behaviors that place one at potential risk. Certainly, we've seen this with other infectious diseases that may have begun within one population and then over time spread to become much more widespread, much more ubiquitous. So people need to know about that. In terms of delivery of the vaccine, we actually have had a very highly structured plan that has been guided by the CDC around distribution of the limited vaccine. During the very first phase, this was divided into a 3-phased approach. During the very first phase, the limited vaccine supply has been targeted to the immediate direct contacts of identified cases in an effort to reduce the likelihood that they would go on to develop active disease and help to contain the outbreak. As more vaccine has become available, although still in very limited supply, we've been able to expand that circle of people who are believed to be exposure risk contacts for monkeypox and include them in vaccination. We've, as I noted, further triaged that or targeted that on the basis of locales where the highest concentration of cases of identified outbreak have been occurring. Again, this is not dissimilar to the age-based approach that we were able to take with the COVID-19 vaccine, where the risk there clearly had a very strong age-based indication. Ultimately, what our goal would be to have sufficient vaccine that we could do what is known as pre-exposure prophylaxis, i.e. allowing people to get vaccinated before they ever encounter the disease because they are worried, they're concerned that they might be at higher risk. We are very eager to be able to reach that point. However, it is going to take more vaccine. So again, like with the very initial launch of the COVID-19 vaccine, we're in a situation with the Jynneos vaccine of shortage and having to triage the distribution of vaccine, which is not where I would like to ultimately be. I would much prefer to be in a situation where we had sufficient vaccine that we could go right to both a combination of post-exposure prophylaxis or PEP and PrEP, which would be pre-exposure prophylaxis. I don't know that my colleagues would have anything to add, but
yeah, Dr. Vanderhoff, if I may, I'll just give you a reflection of what's happening here in Franklin County. In Franklin County, we have a great partnership with Columbus Public Health, and Columbus Public Health is actually taking messaging on monkeypox and the vaccines with local community partners, whether it be Stonewall or Equitas, and those are healthcare institutions, and they have infrastructure really that are connecting directly with the LGBTQ plus community on monkeypox education and actually providing the vaccines and bringing vaccines to where those populations are who need them.
Okay, our next question is from Joe Ingles with Ohio Public Radio and Television.
Hi, doctors. Thank you for taking this call, doing this call. I want to ask about COVID. We still have a lot of people who are running around with COVID. They don't even know they have it. And sometimes when you test for it and you have symptoms for it, now with this variant, you have to test 3 or 4 days in a row to get a positive result when you could have had it and it wasn't showing up in the testing. I mean, how do you deal with not spreading that? Because these people may be going around, while it may be mild for them to have COVID, they may be going around people thinking they're safe because they had a negative test, and the people that they're going around would not be safe if they got this version of COVID. Can you talk about that?
Yeah, I think that we're at a stage in the evolution of this epidemic, this pandemic, in which we have a very, very high degree of population immunity in the way that I described previously, and that's good news. But as you point out, and as we've really been talking about, even with vaccination, the development of immunity for monkeypox, that's not the only thing that we can all rely upon. When we think about COVID-19, we also have to think about our personal situation. We've had a number of reports. One I read in one of the major national lay publications that I think rightly pointed to the fact that if you're less than 60 in good health and vaccinated, your likelihood of developing severe illness is very, very remote indeed. However, we have many people in Ohio who have underlying medical conditions, who may be of advanced age, who in fact are vaccinated, and yet still this virus poses some risk. And for those individuals, we really do strongly recommend watching the CDC community levels map and wearing a substantial, preferably N95 or KN95 type mask when they're going to be indoors and around people. That is going to be very important. Be mindful of ventilation, and also limit the number of circumstances where you are in those kinds of environments and the duration of time that you're in those environments. At the very first sign of not feeling well, we'd strongly encourage people to get tested. And if you are at higher risk, hopefully you've worked with your provider that you've got a plan in advance for testing and then seeking treatment, having a treatment plan ready to go so that we can mitigate against the risk that you'll go on to develop even further illness. One other thing I'd add is that some individuals may be eligible for a monoclonal antibody administration that will provide them with a substantial degree of immune boost for about a 6-month window. And we would strongly encourage them to be talking to their physicians if they have chronic underlying medical illnesses that may make their immune systems not as good as they once were. The combination of those approaches can be very, very helpful because you're absolutely right. It's very possible for someone to have COVID-19 and not even know it, or have very mild symptoms that really aren't registering for them, and yet they're able to spread COVID-19 to others. My colleagues, anything that you'd want to add?
Yeah, I think Dr. Vanderhoff, the big thing that I want to add is talking about vaccines a little bit. We really want everybody to be up to date on their vaccines. And nationally, for those 65 and above, under 40% of that age group have received their second dose of the vaccine. So that to me is a concern, because when we see people coming in the hospital now because of COVID, it's still those who are not vaccinated or those that are most vulnerable, like the elderly, who are not up to date on their vaccines. And that's really important moving forward. If you're 65 and above and you're eligible to get that second dose, please get that second dose now. You'll still be able to get the updated booster when that comes out, hopefully sometime this fall. In addition, just to reiterate what Dr. Vanderhoff just said, have a plan in place. What's your plan to get tested if you have symptoms, and what's your plan if you have an at-risk condition to get the outpatient treatments, whether it be Paxlovid or the monoclonal antibodies.
All right, our next question comes from Spencer Hickey with the Hannah News Service.
Thank you. Also on COVID, it looks like Ohio, from the latest CDC numbers, has 67 counties at a high community level. And I believe it was 5 on July 14th. you discuss that increase?
Yeah, as I referenced in my earlier comments, we have seen a fairly moderate wave of recorded cases and a much more modest rise in hospitalizations and virtually no increase at all in ICU admissions. But what we have witnessed is the BA4, BA5 subvariant has indeed caused a summer wave of COVID-19 in Ohio. The good news, as I shared, is that comparatively, given what we believe to be pretty widespread transmission going on of this virus, comparatively, the burden of severe illness that our communities have had to cope with has been dramatically less than we've seen with other waves. If we compare what we estimate the likely rate of transmission, given the fact that many are not testing or have tested and have not reported their result, both nationally and here in Ohio, but we are really looking at a wave that had this hit us 6 months ago, would likely look a lot like the wave that caused us to have to call up the guard in order to be able to support our hospitals. But thankfully, those combination of factors that we've outlined, vaccine-based immunity, which has played a huge role, augmented by instances of recovery from infection, often producing what we know as hybrid immunity, coupled with some very effective treatments, as well as a preventative monoclonal antibody that some of our most vulnerable patients have been prescribed by their treating team, have really seemed to be making a difference. And we're very gratified by that.
Okay, our next question is from Laura Hancock with Cleveland.com.
I am just wondering, earlier in the press conference, you guys had talked about the importance of children getting vaccinated for everything, that there had been a measles case in the state, that there's a polio outbreak that occurred in New York. And I was just wondering, do we have evidence that childhood vaccines have gone down in Ohio? And is that connected to skepticism with the COVID vaccine? Thanks.
Yeah, great question. Indeed, as I referenced, we have seen a decline in the number of children who are reporting completion of required childhood vaccinations before entering school. So we know that in fact, there has been a decline. Now, thankfully, the majority of students are keeping up to date on their vaccines, but we really believe this to be a combination of factors. One is, look, the COVID-19 pandemic disrupted all of our lives. It interfered with many activities of daily living, including getting out for routine doctor visits. Yes, we do suspect that there is some level of just general anxiety or fear about vaccinations generally. We do see that ebb and flow over time. But we also think that there may be an element of us having been lulled into complacency because our vaccines have done such a good job. Many of the diseases that were really a major source of anxiety for parents in previous generations don't even cross people's minds now because vaccines have done such a good job. But what we are reminding people is that unfortunately, we don't live on an island. This is a global environment. And when a case pops up in one part of the world, it can spread to other parts of the world pretty easily. And I think some of that data coming out of the wastewater surveillance in New York should be very sobering to us. The evidence of polio virus in multiple wastewater regions in that state really strongly suggests that there's some level of community spread. And that would mean that a subset of unvaccinated people or under vaccinated people could be at real risk for this disease that paralyzes can, in circumstances, do worse in terms of being life-threatening. Dr. Forbes, this is really your area of expertise. Any thoughts?
Yeah, I think it's a great question. We saw a similar dip in pediatric vaccinations during H1N1, I think in 03 or so, maybe that was 09. But it is a curious phenomenon that when there is this large epidemic, that the vaccination rate goes down. My expectation is it would go up because people want to be protected from the things they can be protected from. But I think culturally there's definitely a gap. And I think you highlighted a number of the reasons. Part of it is people don't know, fear. What I would add to finish up is really talk to your healthcare provider, the person you are trusting to take care of your children with you, and they'll give you the advice you need. And again, you'll make the final decision. But we really encourage people to get the entire battery of vaccines. We know there are a lot, but they also work, and I think that's the right thing to do.
Okay, our next question comes from Jim Provence with the Toledo Blade.
Thanks again for doing this. I don't know who would answer this question, but I was just curious, what does the federal emergency health designation for monkeypox allowed you to do that you otherwise would not have been able to do?
Well, I'll begin, and then my colleagues can certainly add in. I think among the most important avenues that opened up was the potential, and I don't know how they're applying this in Washington, but those emergency declarations can open up pathways of funding that may not otherwise be open, and enable steps like the FDA was able to take under the emergency use authorization of this alternative method of vaccine delivery. So it can be an important mechanism or important tool for rapid public health response at the national level. I don't know, colleagues, anything?
Yeah, I'll just add to it. I think, having it declared as a national health emergency really brings awareness of monkeypox to everybody in the public. Previous to the national announcement, it was more of a conversation that was taking place within the LGBTQ plus community. So I applaud that it has been declared a national emergency. I think for me as an infectious disease doctor, the one thing that I'm grateful for is the fact that with this declaration, we now have emergency use authorization of giving the Jynneos vaccine intradermally, which will significantly increase the amount of vaccine available to give to at-risk communities.
Okay, our next question comes from Jonathan Jackson with NBC4.
Thank you guys for taking the time. I just wanted to ask for anybody who's available to talk on this, but how soon about the website and a dashboard for monkeypox? I think you touched on it a little, Dr. Vanderhoff, but if you could go into more detail on how soon people and residents can see that.
Yeah, so we've actually been doing the background work to have this able to be activated pretty quickly. But as I shared, numbers during the month of July were very, very, very low and really didn't either justify creating a dashboard or allow us to do so in a way that wouldn't potentially inadvertently compromise patient confidentiality. When you have very low numbers, it's almost like putting a spotlight on the few people that you've identified with the condition. But now, as the numbers are rising, we feel more confident that we can stand up a dashboard. I do not anticipate it's going to take us a very long time, probably yet later this month, we should have that up and going.
Okay, our next question comes from Alexa Helwig with Local 12.
Thank you. Just a quick question. I'm working on a story today about COVID-19 and back to school. And I know you guys touched on this a little bit earlier, but just with the variants and an increase in cases, do you just have a message to some parents or those parents who are maybe a little concerned to send kids back to school?
Yes. So a couple of things that I would want parents to be thinking about. First of all, going back to school means going and being, of course, back around a lot of other people that you're student may not have been around over the course of the summer, it's one more reason for parents to get their child vaccinated. So that's probably the most important step that parents can take as their children head back to school. If they haven't been vaccinated, get that vaccine started. If they're not up to date, get that vaccination up to date. As Dr. Forbes shared, we have plenty of evidence that suggests that even having had a prior infection, it is not a reason not to consider this. In fact, they work synergistically. They work well together and create so-called hybrid immunity, which really seems to be the best immunity. The second thing I'd say is that and this is parental judgment. They have to think about their child's situation, how their child learns, how it's best for their child to interact. But there is always the opportunity for a child to wear a proper mask at school if they so wish. The good news is, however, that we really have seen that our school environments have been very, very mindful of a lot of the issues that relate to ventilation, and that we have not seen the school environment as being one of our more risky environments. So I think that parents can have a degree of confidence about that environment in the context of the risks that are inherent anytime we get people gathering together. Lastly, I would point out that our children have weathered this particularly well, and we do have lots of evidence that most children do best by being in school in person. And so we really do see that as a developmental priority for our students. Dr. Forbes, as a pediatrician, I think I'd turn the rest over to you.
Sure, thanks. Again, another great question. Part of the advice that we would want to give to families is as they go back to school, this is, we think of this as their life, right? This is for us as adults, we go to work, they go to school. And so they don't want to miss any school days. And so even becoming mildly symptomatic means that they're at risk of missing school. And so we try to, again, prevent what we can prevent. And so if you make sure all of the vaccines are up to date, it is a substantial ask, but we understand that. But I think you want to make sure that they don't miss school days. They don't miss participation in sports. They can live their life as kids. And that's really what we want. And finally, talk to your healthcare provider and get the advice from them, the person who you are trusting to help you to raise your kids. And I'm sure you're going to get the good advice you need.
Okay, our
Thank
final
you.
question today will come from Nick Evans with the Ohio Capital Journal.
Hi there. I've seen reporting elsewhere with regard to monkeypox about a kind of, mismatch between access through public health departments versus primary care providers. Essentially, people will go to their primary care provider and then have trouble getting into testing or have trouble getting a vaccine through that because of the sort of, for lack of a better term, bureaucratic hoops they need to jump through from the PCP point of view. What's being done or what can be done to sort of eliminate those challenges in Ohio?
Yeah, thanks. That's a great question. So I think there are a number of things that can be done and in fact are being done here in the state of Ohio. First, we have to be thinking about assuring that trusted providers are in a very, very good position to be able to not only provide active advice, but get people to the resources that they need when they need them, whether it's testing or vaccination. So we've worked very, very hard through a whole variety of mechanisms, including some social media education that I know Dr. Gastaldo participated in and can probably speak to get information into the hands of our providers, especially our primary care community, whether pediatric or adult primary care community. And so there's a lot there, and I feel fairly confident that our primary care community in Ohio is more knowledgeable perhaps than some because of those efforts. The second thing is to work very, very closely with our local health departments. And we've maintained a very active dialogue with them. And we provide easy pathways for them to connect back into the Department of Health for further support and guidance as needed. And then there are the community organizations that are very important. Some of those are federally qualified health centers, which serve both the role of a primary care office, but also in many circumstances, trusted sources of community information. And we're working very closely with those, as well as other organizations. And Dr. Gastaldo mentioned some of the organizations with whom we've worked. So I think it's a multifaceted approach, and it is really about getting information to people's providers and people's existing trusted sources of healthcare guidance. Dr. Gastaldo, I know you've participated in some of this.
Yes, from a monkeypox perspective, from the patient's point of view, things are very different and much better today than where they were 2 or 3 weeks ago. For example, here at Ohio Health and most healthcare systems, we have had much education put out there to providers. I have done various video podcasts and Zoom meetings with physicians throughout the state of Ohio, educating them about monkeypox. Here at Ohio Health and in most other healthcare systems, any office can do monkeypox testing. We no longer have to go through the Ohio Department of Health or the local health department to test people. There are many private labs now in the country that can now do tests. We are sending our swabs to an independent lab and getting our results back in a timely manner. When it comes to the vaccine supply is tight. However, that is expected to improve in the very near future with the new FDA authorization. In addition, one other thing just to wrap this up, the antiviral pills. As I said previously, most people will not need antiviral pills, but for those who have an at-risk condition or a severe episode of monkeypox, we would want to give them those medications. And I could tell you, getting those medications have been quite easy. I have personally prescribed those to people in the hospital, and I had a great partnership with my local health department and ODH in getting TPOXX the same day I wanted to give it to somebody in the hospital. So things are getting better when it comes to the patient aspect of monkeypox education and the care they need.
Okay, we want to thank all of our guests today. And Dr. Vanderhoff, do you have any closing remarks?
Well, thank you again for joining us for these press conferences. I want to thank my guests for sharing their time and their expertise. And we'll continue to keep you informed as more information emerges.
All right, that'll conclude today's press conference. And thank you again.